how to overcome ovulation disorder, how to overcome anovulation, how to overcome oligo-ovulation. In this video today, we are going to talk about how to overcome the ovulation disorder. First of all, we shall begin by defining what ovulation is. This is the release of a mature egg on the 14th day of your cycle. When the egg is released on the 14th day, then it means that your chances of getting pregnant have increased on that particular date. Remember that when a mature egg is released on the 14th day, it lasts or it lives for only 12 to 24 hours. Stay with me up to the end of this video and you are going to learn about how to overcome ovulation disorders. This is Gerald Massa, the Health Educator is the name of the channel, and we are talking about how to overcome ovulation disorder. So infertility means that you are not able to get pregnant after at least 1 year of trying, or even after 6 months if you are 35 years or even older. So if you get pregnant, mostly you'll be able to go on and carry the pregnancy if at all you've been monitoring your cycle very well. If you can get pregnant but are unable to stay pregnant, you may be also suffering from what we call infertility. That said, there are actually many causes of female infertility, and ovulation disorders are among the most common. How do you know when and if you are ovulating? There are many indicators. For instance, your cervical mucus becomes clearer and thinner with a more slippery consistency, similar to that of egg whites. Also, your cervix softens up, and even your sex drive or your urge to have sex increases. During each monthly cycle, you typically have around 25% to 30% chances of getting pregnant, though it can widely depend on many circumstances. In this video, we are talking about how you can overcome ovulation disorders. You can only conceive around the time of ovulation, which is between 12 to 24 hours, as we said in the beginning of this video. So ovulation is the release of a mature egg, also known as a Graafian follicle, from one of your ovaries. Many women, the release happens on the left side, but also it could even happen on your right side of your ovary. You do not need to worry about which side you are ovulating from. So generally speaking, ovulation usually occurs halfway through your menstrual cycle, that is on day 14. But as with everything pregnancy related, there is a wide range of normality whereby cycles can range from 23 to 35 days, and even your own cycle may change. Your body temperature may fall slightly and then rise again. This is normally after ovulation has already happened. There are a number of ways to predict when you might start ovulating, and here is the first way you can actually predict that you have started ovulating. One detectable sign of ovulation is the position of the cervix itself. We are talking about the number of ways you can predict that you are about to start ovulating or you are ovulating. Remember, in this video we talk about ovulation. We are talking about ovulation and how you can overcome the disorders. Detectable sign of ovulation is the position of the cervix itself. During the beginning of a cycle, your cervix, which is actually, it appears like that neck around the passage from your vagina upwards, it actually stretches, and normally it stretches to accommodate the baby's head. So what happens is that as ovulation approaches, the cervix pulls back up and softens a bit and opens just a little to let the sperm through on their way to their target. You may or may not easily feel these changes. Just remember, patience and persistence are key when you are trying to get pregnant. Though there are no guarantees that you will definitely conceive the first time you are trying, we always request that you should be a bit patient, or you should seek advice from the experts whenever you have tried to get pregnant and things seem not to be working out. If you have experienced irregular periods, you are most likely to have had irregular ovulation. Some women ovulate only occasionally, and some menstruate occasionally but don't ovulate. So you may actually menstruate but when you are not ovulating, meaning you could be having ovulation disorders, and these are these are the two common ovulation disorders. The first one is anovulation, where there is no ovulation at all, and then the next one is oligo-ovulation, where there is irregularities in ovulation. It happens but it's irregular. Ovulatory disorders broadly broken down into two groups, as we've said, and these are anovulation and oligo-ovulation. If you are not ovulating regularly, the cause is usually that your ovary is not receiving the appropriately timed signals to mature and release the egg. These include the hormones, follicle-stimulating hormone and the luteinizing hormone. So the most important thing we need to note is that if at all you are having ovulation disorders, then the best treatment is you first have to have an ultrasound scan done, and then medication can be given after investigations have been done. Medications include clomiphene, letrozole, but these have to be prescribed to you by your doctor after doing some tests. In today's video, we've talked about how to overcome ovulation disorders, and we have said that the first step is to do some tests, identify which type of ovulation disorder you are having, and then treatment can be given. Thanks a lot. Have yourself a fantastic and healthy day.
Hello, welcome to our channel. I'm Gerald Massa, the Health Educator. On this channel, we talk about pregnancy-related questions. We answer all your pregnancy-related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.